Hello there, this is Dr. Mintz. This is an elderly patient who came in with severe headache, sudden onset of severe headache, and here are the findings. And I think you can see that there are findings, but it's one thing to identify that there is a problem, and it's quite another to describe it succinctly and accurately. So, how would you describe this before we get into what it is? I would say that there is an area of abnormal high attenuation in the basal cisterns involving the suprasellar cistern and extending out into the middle cerebral artery cisterns and into the anterior interhemispheric fissure along the paths of the anterior cerebral arteries. This is hemorrhage. So, given that it is in this subarachnoid space, these cisternal spaces, which are subarachnoid anatomically, this is a subarachnoid hemorrhage. And this stellate, kind of star-like pattern of distribution of the blood is typical of many subarachnoid hemorrhages. The blood often occurs here because the circle of Willis, the vessels of which are in this suprasellar region, often give rise to the subarachnoid hemorrhage due to a small aneurysm, usually at a bifurcation point, in the vessels of the circle of Willis. So here we have little tracks here that are probably going right along the anterior cerebral arteries. Here are the middle cerebral artery cisterns going off in both directions with subarachnoid blood tracking along them. And there's some blood in the prepontine cistern, and that would be right here. Here's the pons, prepontine cistern. Then if you go up a little higher, you're in the interpeduncular cistern. That's the little V-shaped notch right here. And a small amount of blood has also gone into the left lateral ventricle, and you can see that there are little tracks of communication between the suprasellar cisterns and the ventricles through this region right here, and you can actually see the path of the blood from the suprasellar cistern into the left lateral ventricle. Here you can see two components of those two areas. So this is a classic subarachnoid hemorrhage. Hemorrhage in the suprasellar cisterns with a small amount of intraventricular extension of the subarachnoid hemorrhage. Elsewhere in the brain we see that there are low attenuation areas of abnormality in the white matter, which are nonspecific but often referred to as age-related ischemic gliotic changes, or chronic white matter changes, or chronic ischemic white matter changes. Any of those are fine. We just describe them in this general manner because we don't know for sure in any given case exactly what they are, and it's always possible there's something less common that would not be known based on the patient's clinical presentation or history. We also have some chronic infarcts in the cerebellum. Those are not uncommon. It's more common, however, to get chronic infarcts in the basal ganglia, and here's one here. So in the basal ganglia you have the caudate. Here's the caudate on the right. The putamen, which is here, and we see a little infarct in the putamen. Caudate, putamen, and then the globus pallidus is in this region. This is the thalamus. Caudate, putamen, globus pallidus in this region, and this is the thalamus. A tiny bit of blood is present in the dependent aspect of the right lateral ventricle. So a classic case of CT head in a patient with subarachnoid hemorrhage and minimal intraventricular extension.